Hello, I'm Dr. John Perlman, Beverly Hills plastic surgeon. I'd like to speak to you for a few moments about breast uplift surgery, which is a confusing term for many people. Many patients who come to my office have successfully felt better about their body by undergoing breast augmentation, but for some, placement of silicone or saline implants simply isn't enough. Basically, if a woman's nipples are low on her breast or literally hanging on the lower portion of the breast, we have to consider something to raise their position and provide some degree of uplift to their breast. This is typical in women who've had one or more pregnancies or in women who've lost and gained a lot of weight over time. But some are literally born that way, although that's more unusual. So placement of a breast implant alone will fill the breast but may exaggerate the droopiness, and that's usually not desirable. So there are two forms of breast lifts that I use. One I call a limited uplift, which involves a circular incision around the areola, which permits me to narrow its diameter, often needed, and to raise the position of the nipple to maybe a position 3/4 or an inch higher on the breast. That, combined with placement of an implant to enhance volume, is very often a magical solution to make a breast look much fuller and more youthful, and certainly less droopy. But for those with more severe droopiness, where the nipple actually lies below the crease under your breast, a full uplift is usually necessary. And this involves a typical keyhole pattern incision, which is well worth the trade-off of having the incision lines to really significantly uplift the nipple areolar position, sometimes up to 2 or 3 inches even. It's also a good procedure when somebody who's perhaps had breast implants wants to go a lot smaller years later, and something has to be done with that extra skin. So the full uplift is a good technique to remove enough skin to make a substantial difference in the volume and size of a woman's breast when breast implants are being exchanged. If you have any questions, please email me at jonap@ucla.edu or go to my website, www.perlmanmd.com, or call my office, 310-854-0031. Ask to speak to Elsie, and we'll be glad to arrange for a consultation so we can meet in person and discuss ways that I may be able to help you. Have a good day, and thank you for your time.